Hi, and welcome to the State of 911 webinar series, hosted by the National 911 Program. My name is Sherry, and I will be the moderator for today's session. This webinar series is designed to provide useful information for the 911 stakeholder community about federal and state participation in the planning, design, and implementation of next-generation 911 or NG 911 systems. It includes real experiences from leaders utilizing these processes throughout the country. Today's session will feature Michael Alagna, Program Director of the IJIS Institute, sharing information on the Institute's Text-to-911 translation project, along with Julia Fisher, the Geographic Information Officer and Director of Data Services for Maryland Department of Information Technology, discussing how Maryland is using GIS to improve data access related to COVID-19. For closed captioning, please copy and paste the URL link in the chat window to an additional web browser. For more information on National 911 Program webinars, to access the archived recordings, or to learn more about the National 911 Program, please visit 911.gov. Feedback or questions about the webinars can be sent to the National 911 team at mcp911.com. Please note that all participants' phone lines have been put in a listen-only mode, and this webinar is being recorded. To ask questions of our presenters, feel free to take one of two actions. Using GoToWebinar's chat feature located on the right-hand side of your screen, enter your question at any time during the presentation, and it will be entered into a queue. This feature is not visible while your screen is in the expanded page view. Or to ask your question live, you can use the raise hand feature to request your phone line be unmuted, and you will be called upon to ask your question. Individuals registered for this webinar will receive access to today's PowerPoint presentation along with the webinar recording. With that, I'd like to ask Lori Flaherty to introduce our first speaker. Go ahead, Lori.
Thanks, Sherry. As Sherry mentioned, Michael Alagna is the Program Director for the IJIS Institute. And for those of you that are not familiar, the IJIS Institute is a nonprofit alliance that works to promote and enable technology in the public sector and expand the use of information to maximize safety, efficiency, and productivity. They focus on driving public safety technology innovation and information sharing to promote safer and healthier communities. Michael is going to provide details on the Institute's initiative to address the technology standards, the affordability, and the affordability of a commercially available public safety grade solution for text-to-911 translation. Michael, the floor is yours.
Thank you for the introduction, Laurie. I appreciate it. Our pleasure to provide a program overview for this text-to-911 translation capability. Laurie, you're quite familiar as you were a key member of our executive committee on this project, so this should sound very familiar. Let me go to the first slide, Sherry. So this project would not have been possible without the support of the Department of Homeland Security Science and Technology Directorate, specifically their first responders group. Let me just begin by saying text-to-911 is the ability to send a text for help to a PSAP or an emergency communications center. I'll use those terms interchangeably, emergency communications center, ECC, or public safety answering point, PSAP. There are scenarios where a voice call to 911 is not optimal, and we've heard from our public safety practitioners that text can alert them to crimes in progress. Things like domestic violence situations, home break-ins, carjackings, mass shootings, and hostage situations are all just a few examples where calling 911 would draw attention to the victims and could cause additional danger to the caller or escalate the situation. Next slide, please. The IJIS Institute is grateful for the active participation and support of our member companies and their professional representatives, as well as the many public safety practitioners who devoted time and shared their invaluable expertise for this project. The project was a collaboration between industry 911 call center technology providers, language service providers, standards development organizations, PSAP and ECC operators, policymakers, and we were all convened to address the interoperability, technology, standards, and affordability of a commercial solution for text translation. Next slide, please. Let me start by saying for many citizens, residents, and visitors in America with limited English proficiency, that's LEP, emergency situations can become compounded when trying to communicate with public safety officials. Census data reveals that 60 million people nationwide speak a language other than English in their home, and approximately 25 million people are identified as limited English proficient. Phone usage data shows that around 90% of non-English 911 calls are conducted in Spanish. Other non-English calls are spread out between approximately 350 other languages. Public safety officials have found in many cities and municipalities that soon after implementing Text-to-911, emergency call centers begin to receive text communications in languages other than English, thus necessitating the need for translation. In jurisdictions that have a large non-English speaking population, PSAPs and ECCs are hesitant to deploy text services without a reliable translation capability. Translating text messages poses a technical and operational challenge. There are concerns about the reliability of computer-assisted translation known as machine translation. We'll talk about that here later. And the other key point is that public safety is accustomed to having language experts available to respond to non-English emergency calls for service. Next slide, please. This is a little bit of view of what's going on currently. So sending text to 911 from a mobile device, it's becoming more common across the US. Between the Federal Communications Commission, the FCC database, and sort of informal reports we receive from industry, estimates are that somewhere between 20 and 40% of the 6,000 PSAPs in the US have implemented text to 911. Text to 911 messages are delivered by what is known as carrier native SMS. This is a short messaging service. Importantly, photos, videos, multiple recipients for a text message, or non-Latin character sets, for example, Chinese, Arabic, are not currently supported by what is described as an interim solution. Given the conditions of startup, a lot of the public advocacy has included this concept of call when you can, text if you cannot, text if you can't. And the discriminate texting to 911 has been discouraged. As public safety moves toward new technology and replaces legacy call routing with next generation 911, next generation services will offer Internet Protocol Networks, ESI nets, that connect originating service providers with public safety answering points, PSAPs, in effect expanding the capabilities of all the available information to emergency response. And while SMS, text to 911 service, is not considered to be next-gen 911, and next-gen 911 end state is not required to implement the current text services, they are interrelated, and I think a stepping stone to the future. Next slide, please. So public safety experts understand that the nation's current system is not capable of handling the text, data, images, and video that are increasingly common in personal communications. But what happens when the text to 911 is not in English? And here are some of the key points we found. PSAPs often have a foreign language speaker who is assigned the non-English text, and this is particularly prevalent with Spanish. But there are over 150 languages in common use, and it's unreasonable to expect that there will be an on-site translator in all cases. Alternately, we heard that the call taker copies and pastes the text into a web browser version of a translation application, for example, Google Translate. And for years, PSAPs have had a reliable, reliable over-the-phone interpretation for language service providers to effectively serve the limited English proficient population. Most major language service providers offer well over 200 languages, 24 hours a day, 365 days a year over the phone. And these interpreters are often available for immediate response, but these services are voice only. Next slide, please. The IJIS Institute and the Department of Homeland Security, along with Google, hosted a Text-to-911 translation tech fest at the Google campus in Kirkland, Washington. The event included participation from technologists, public safety leaders, and language service providers. At the Tech Fest, we simulated a PSAP technical and operational environment with both machine and human translation capabilities through on-site and remote access to technology components and human resources. This Tech Fest sought to enable translation services integrated into an emergency call center with the equipment and the ability to conference in a language service provider that would be a human for coaching of a text translation. The demonstration enabled the use of human interpreting services to augment machine translation of non-English text. Next slide, please. So just a summary of where we are today, and then we can move to the future. So sending text is becoming much more common, but trying to get a handle on the exact numbers of current PSAPs that have deployed text to 911 is a moving target. We would estimate around 30% of the nation's 6,500 PSAPs have implemented text to 911 services. On the other hand, there's no data available on the number of PSAPs or ECCs that are providing translation services. And we talked about the current text to 911 solution being constrained by legacy technologies, the interim solution. Photos, videos, and non-Latin character sets are not currently supported or delivered by the carriers. And officials continue to emphasize or prefer voice communications over text with the call when you can, text when you cannot campaign. Data from industry reports that approximately 2 million text to 911 calls per year require language assistance. And you can compare that to over 240 million voice calls made to 911 in the US each year. Assumptions regarding text to 911 is useful during incidents that would put the victim at risk wasn't supported by the data that we collected. I think that's an important point, that what we saw in text usage, it looked very much like what would occur on a day-to-day basis. So these were not those use cases where it was would have been an issue for a caller or texter to contact 911. These look very much like typical calls for service. Next slide, please. Let's talk about, Let's talk about machine translation. PSAPs are increasingly dependent on translation applications for handling non-English text. This is commonly referred to as machine translation, and it's translation of text by a computer. What we did in the project is reviewed and analyzed the automated translation of text translations between members of the LEP public and a 911 call center in the United States. Messages were translated from Spanish into English and vice versa. The machine translation output for each message in the data set was assigned a score. This is commonly referred to as a blue score. That's a bilingual evaluation understudy. It's an algorithm for evaluating the quality of text, which has been machine translated from one language to another. The average score of the automated translations suggests that machine translation was able to produce high quality results. By contrast, we had expert linguists who focus on whether the intended meaning of a message was conveyed in a given translation and considers other factors such as context. The average score across all translations indicated that machine translation was less than acceptable from a quality standpoint. While there were many instances in the data where machine translation produced high quality translations, the data also contained numerous examples of complete failures on the part of the machine translation engine. The most common cause of machine translation failure was that the engine could not parse or interpret the incoming text correctly due to linguistic defects, things like typos, misspellings, lack of punctuation, and non-standard representations of common words, things like text speak, the things we do typically in a text application. Next slide, please. More about this tech fest that we conducted with Google. There we demonstrated the ability to have services integrated into a conference call environment via text with a language service provider. This was so that a human could, quote unquote, coach a machine translation session. For years, the emergency communications centers, PSAPs, have had reliable over-the-phone interpretation services, and they pay for these on a per-minute basis. ECCs are trained to work with these interpreters in real time, and the technology burden with 911 centers is well understood. However, the over-the-phone interpretation market is not large enough that ECCs could benefit from sharing the costs of commercial solutions with entities that operate a call center for the use of text translation. None of the factors that support over-the-phone interpretation hold true for text-to-911 from a business case perspective. And so lacking this business case, human-assisted interpretation of text-to-911 for emergency call centers will remain dependent on machine translation due to its low investment cost and the potential upside as this technology continues to improve. Some conclusions out of the Tech Fest were that given the critical and serious nature of 911 emergency communications, there is some caution about relying exclusively on machine translation as a means of enabling communication via text messaging between the limited English proficient public and public safety officials. Successfully enabling this communication across the language barrier requires more than translating individual messages in isolation. The intended meaning of a message cannot be understood or properly translated without considering additional contextual information. And even in cases where an individual segment was translated well by machine translation, closer analysis of the translation often reveals that a different translation was needed given the context. Next slide, please. So some conclusions. The large tech firms like Google, Microsoft, and Amazon will continue to lead on machine translation. It's just a massive resource requirement. There's no business case for over-the-phone human interpretation, as we said, so there needs to be additional work around a cost model that would support public safety and industry if, in fact, human resource coaching translation services are a requirement. The analysis of machine translation found that 50% of these machine translations were scored as comprehensible or better, and expectations are that accuracy will improve. And given that budget constraints, public safety organizations will remain dependent on machine translation due to the low investment costs. We suggest continued work needs to be done on the technical enablement and business case to allow participants an escalation option to be connected with a human interpreter or translator. And further research and development is needed so that text translation can be highlighted, and the need to have emergency response technology providers use machine learning to get components and computers to improve based on actual public safety use cases. Another recommendation would be, should machine translation be used for translating emergency messages, it's critical that all parties involved receive a disclaimer that machine translation is in fact being used to translate their messages. That's the final slide. The last slide being contact information, should you have questions or need additional information. Thank you.
Well, sure. Thank you, Mr. Mike. We're now going to start the Q&A portion of our session. As a reminder, to ask a question, please use the GoToWebinar's chat feature located on the right-hand side of your screen, or press the raise hand button. Sheila, go ahead with our questions.
Thank you, Sherry. Our first question, will you be testing in a real PSAP?
Thanks for the question. The goal of the project was to transition to PSAPs, but the project was ended and DHS funding was not available to continue to the next phase. So we did not make the transition to actual PSAP testing, although that was an original goal.
Thank you. Where did you get your data?
The database that was analyzed was provided by a commercial service provider that is offering text translation services in the marketplace. It was based in the Texas region. I think it was Houston, actually, or Harris County. It was a database that consisted of approximately 5,000 text-to-911 requests for emergency services in Spanish. And that was the basis for the analysis of the accuracy of machine translation.
Thank you. What additional work is needed to have a better solution?
That would be a long answer to that question. Briefly, I think one of the major conclusions was there are a couple things. First, the underlying technical architecture of the public safety answering points needs to improve. So the transition to next generation will facilitate this, the ability to have access from the public to the public safety officials generally, for not just text, but for other services. What we found was the ability to implement text required us to work with public safety that was further along in the maturity model, moving towards next gen implementation. So the ability to kind of work with legacy installations proved problematic. So the overall state of advancement of technology solutions to support next generation, I think, is important. The idea that a human is needed to provide the necessary, I'll call backstop for improving the accuracy of a machine needs additional exploration. Is there a business case to support that? Could it be operationalized in real time? Or are we in fact, I think, more predisposed to move in the direction of machine translation, things like Google Translate? It seems that the economics are going to drive us towards the computer solution. And that being the case, there needs to be more work around how the machines translate, in this case, public safety interactions. A lot of the translation tools are just generally available and driven by machine learning that's, I would say, generic in this case. What we suggested and found and worked with Google on was this idea that public safety and public safety solution providers need to start training machines to better handle public safety transactions. The language is different, the nature of the incident is different. And so there's the possibility to work closely together between industry and public safety to actually improve that 50% accuracy rate pretty quickly up into the high 80s if we could train these machines to understand the requirements of public safety. So there's a couple of ideas.
Thank you. Did Google express any legal or policy concerns about their existing machine language translation tools being used in 911 centers?
Yes, they did. They said that that is not something that the application was intended for, and they would not accept liability in that case. So there is a legal and liability question that sits at the heart of this problem.
Thank you. Can AI or natural language processing be used to improve the quality of translations?
Exactly. So that was the question just before. So absolutely, but it would require an effort by public safety and industry to work on that specifically. There was an idea that there could be additional funding from the Department of Homeland Security to enable that platform to use machine learning to improve this application. So exactly the point.
Is there a voice-to-text option where foreign languages are converted to English so the operator can understand it?
I think that is in place. We did not explore that capability specifically, but I'm pretty sure that's a capability contained in the platform, but this was not a part of our analysis.
And we keep getting some more questions here, some really good questions. Our next question, is there any data on the difference in PSAP ability to respond to a text message between machine versus human translation?
So let me clarify, because there's currently no ability, well, let me make sure I understand the question. There's no ability to have.
I can add two for you. The follow-up was such as time from message to dispatch, so looking at the timeline.
Yeah, so operational concerns, I think, rise to the forefront. First point is the assumption would be that the human translator is on site. So let's assume that's the case, because currently there are no language service providers providing text translation services. So the ability of the machine versus, say, you had a telecommunicator with native Spanish-speaking capability on site. I would say that the native speaker is going to be able to get to the context quicker. What happens in these engagements is that while the machine might be only accurate half the time, as the conversation goes on, it improves because of additional context back and forth. But that has to be by the, if you're operating on the machines, let's say, you would have to have the machine translate from Spanish to English, and then the telecommunicator would have to type in English the reply, which would be translated to Spanish. and vice versa. So that transaction is not as efficient as having a human sitting there doing it in real time. So there's a little bit of a incentive to have the human on site, but with 150 languages in use, and when we move from the interim solution to what's going to be the multimedia capability, we'll be delivering many more languages to the PSAPs in addition to, say, Spanish. These Latin characters are Spanish. So it's going to open up to 100 approximate languages. It's unrealistic to expect that you have that kind of resource on site. And so there is a balance between operational efficiency, accuracy of a human interaction versus the machine on site versus having a human off site, and whether there's a business case or time to respond, the operational concerns of what that would entail of connecting to a over the phone kind of interpreter support. So that's exactly at the crux of this, the operational concerns versus the technical concerns versus the ability to support in real time. I think that gets right to the issue.
Okay. I know that we are still receiving quite a few questions, but we are going to move on to our next presenter. Sheila will capture all of the questions that come in. We will either answer them at the very end of today's webinar, or we will email them to Michael, and we will have the answers posted once we post the recording of today's presentation on 911.gov. So
Okay.
with that, sure, thanks, Mike. And with that, I am going to ask Lori to introduce our next speaker.
Thank you, Michael, and thanks so much, Sherry. Our next speaker is Julia Fisher. Julia is the Director for Data Services. She's the Director of Geospatial Services and is the Geographic Information Officer for Maryland's Department of Information Technology. Julia is going to share how Maryland officials are providing a clear picture of the state's COVID response and how statistics and data are used to support decision-making during this response, recovery, and rebuilding phases in this unprecedented event. Julia, please go ahead.
Can you hear me?
Yes, ma'am.
Wonderful. All right. Well, thank you. I appreciate the introduction and the opportunity to present today. I have to start off by saying that I have a wonderful team who works alongside myself. There are about 10 of us within the state of Maryland who have been dedicated to this initiative throughout the COVID-19 response, specifically as it relates to how GIS is supporting our response in Maryland, how that response is being supported through open data, and then the sharing of confidential and secure and private data amongst our other state agency collaborators. So I just want to make sure that I throw a shout out to my team. Again, very privileged to have them alongside me. So if you would go to the next slide, please. So I put my contact information up at the very front, but usually alongside an introduction. But Lori, thank you for covering that. But if you are ever trying to get a hold of me, imap.maryland.gov, thank you, is our main site. Data.imap.maryland.gov is our main open data platform. You can go ahead to the next slide. So a couple of things. Oh, it looks like my slide didn't translate quite as I'd expected. So these are supposed to be 5 bullet points. I'll first just talk about the COVID-19 site specifically, Then I will move on to the open data aspects related to that, transparency, applications, and dashboards that we are providing in addition to the main site, our operational dashboards. And then this is one of the biggest things that we are starting to push forward or continuing to push forward is the fact that there's a lot of analysis that's possible out there, but by utilizing a mapping platform, by adding a X, Y, and sometimes a Z coordinate, there is an entire new portfolio of analytics, and that's spatial analytics, that can be explored, and that is something that continues to be new and continues to reveal new concepts to our partners and our collaborators. So if you'd like to advance to the next slide, appreciate it. So as was mentioned, I am the Geographic Information Officer for the state of Maryland. We have a platform called MDI Map. It has been in existence for over a decade. I am privileged to have worked alongside and for my predecessors who were the pioneers in establishing the MDI platform, that is our enterprise platform for GIS within the state of Maryland. So that is now, my responsibility to continue to grow and cultivate that platform. And as a result, when the COVID-19 response was initiated within the state of Maryland, my team was able to establish a Esri hub site. Esri is our main GIS platform and has been since the beginning in Maryland. And coronavirus.maryland.gov was established as our main site within the state of Maryland. Specifically right now, we're focusing on collaborating very closely with the Maryland Department of Health, the Maryland Emergency Management Agency, as well as the governor's office to use this site to provide safety and health-related information for citizens of Maryland. So I encourage you to go out and explore the site if you have not already had an opportunity. And I am always welcome to feedback. We are always looking for ways to improve upon the site. I was launched in early March, or mid-March. It was initially a demo site was set up in 4 hours by one person. So I want to give a big kudos to Esri as well for providing such a platform that could be established and set up in a very short period of time with limited resources. So as you can see, as of the last time before I was prepping these slides, we've already had almost 4 million users, almost 17 million page views. We have never seen any kind of recognition or acknowledgement or activity to this level within our GIS platform ever before. So for us, we've been thrown right into the limelight, and it's exciting. It's also a little nerve-wracking because there is so much focus, obviously, but again, my team has stepped up to the challenge and has put in countless hours in order to ensure the reliability, the accuracy of the site. So if you'd like to move on to the next slide. So looking at the site is a very public-facing, transparency-oriented site. And the idea is that with responsive design, we're developing once and delivering multiple views. So we have statistics that, as I showed on the last slide, 66% of our users are using the application through the mobile view, but we do have about 35% through desktop and a very small percent through tablet. But again, the responsive design aspects of the hub site allow us to design it once, and it will accommodate each of those platforms. So that has been our utmost, is the user experience. So you can advance to the next slide. And the most exciting aspect for us is that this is a mapping platform. People may think that it's just a website, but because it is a mapping platform, we very quickly and seamlessly can embed interactive charts, maps, and dashboards. Some of the features that you'll see, this is the main dashboard that I've captured from our site. We can add pop-ups so that provides interactive capabilities to get detailed attribution. The tabs allow us to reuse the layout space, so we stay within one frame of, in particular in the desktop, but even as you move to the mobile, there is a limited amount of movement that needs to occur. People use the tabs to replace the information that's currently visible. Lists that interact with the maps and the charts, so we're accommodating those who are used to looking at maps, who are used to looking at lists, and they can interact, and vice versa. As you can see, charts, we have bar charts, line charts, all the various charts, pie charts. Those are all accessible and native functions. And we can easily show those that we're developing for and in partnership with the different options that they have. Legends. So the legends are actually interactive as well. You can click on the buttons that are below the chart, showing what the coloration of the various bars and lines are, and then you can actually hide and show those various aspects within the interactive chart as well. And then, of course, the maps, showing the spatial relevance. As you can see, some highlighting so that people can see. This is displaying cases by county. We have a considerably larger concentration of cases in our metro areas. And so that is not necessarily an unexpected view, but a quick visual confirmation of the activity and trend. I'd like to move on to the next. Thank you. So we're delivering a narrative, and it clearly reports the reality of the situation. That is one of the things that has been at the utmost and forefront of our minds, is that we are delivering a clear message. We are delivering authoritative data. The data that we are receiving is updated daily. It is being captured directly from the epidemiologists, who are capturing it from the hospitals, capturing it from the laboratories throughout the state. So we are getting the information from the authoritative source and delivering that on a daily basis out to the citizens of Maryland. The other exciting thing about all the capabilities of this dashboard, with this embedded dashboard, is that one dashboard is visualizing 21 different data sets of information. So utilizing the tabs, utilizing, all the various capabilities, in that one space, we're conveying a wealth of information. So as you see there, some examples, and cases by zip code is by far our most popular, data set. Excuse me. Next slide. So ultimately, it's all about the data. I learned very early on in my studies within geographic information systems that data, it's 80% of the work, and the 20% is all the fun stuff, as I like to call it, and that has held true. It really comes down to ensuring that the data has been cleaned, the data has been vetted, QA, QC, quality assurance, quality control, all of the data before it is released. And whether that's released for dashboard consumption, or now we are proud to have 27 different layers that have been made available through our open data portals, both the site itself as well as our main open data portal, data.imap.maryland.gov. And this empowers citizens with definitive and reliable data. It allows community leaders to start to analyze the impact within their local communities. It empowers citizens to be able to understand how exactly is this event impacting my life, the lives of my loved ones, those around me. You know, there are benefits to those who are living in other states that have family here, that have access to this information, this wealth of information, because the nature of this particular event has obviously social distanced ourselves, but for those who are truly ill, it has really cut off most communication between, you know, those family members, those individuals. And ideally, this is providing some idea of what is going on and the impact that the activity surrounding the event is really having on these people's lives. And so I, as a civil servant, I'm very proud of being able to provide reliable information presented, you know, in a timely manner. So as you see there, all of this is downloadable, and we want people to take it. We have many bright people out in the community who have the ability to start analyzing the activities in new ways, in new perspectives, and we want to ideally build partnerships so that they can share their resources, their research amongst each other, share it back with the state, all in the name of making better decisions to help with the recovery, help with the response, help with the rebuilding of Maryland. So next slide, please. So as is the case in many other states, the congregate facility setting has been a significantly hard-hit area and population of the community. Within the state of Maryland, between a quarter and a third of our cases are found within congregate facility settings. For Maryland, those are counted as nursing homes, assisted living facilities, mental state hospital facilities, incarceration facilities, including adult and youth, as well as group homes with 10 or more individuals. And so we are updating this data weekly, but this is a complementary dashboard that is on one of our subpages that is focused specifically on transparency regarding cases and deaths by facility of the staff as well as the residents of all of the congregate facilities. So it's over 200 facilities within the state of Maryland that we are tracking this information about and sharing it out. Again, as I show you there, MDH, again, our main partner, Maryland Department of Health, had over 1 million actions once they sent this out. That was the most viral social media communication they'd had to date. It was very unexpected, and we were honored to be part of that, again, to provide that reliable, credible, valuable information out to the citizens of Maryland. Next slide, please. Thank you. Another application that we were working on, again, just trying to improve the user experience. We have a list of testing sites, so we will be implementing a locator application, which will allow someone on a mobile device to self-identify their location and find where the closest testing site is, or manually enter an address to determine the closest testing site and the contact information in order to access that site. We'll also be looking to try to accommodate the mobile testing sites, as those will obviously be moving throughout the state, but we have a plan on how we can use a mapping platform in order to capture that information. Next slide, please. So those, again, are our transparency websites, our public-facing websites. We have two main operational dashboards. I did not share them with you because of the sensitivity of the information, but one is specifically regarding the PPE tracking. In addition to our existing partners, we've actually added the Department of General Services, which houses our Chief Procurement Office, and they have also become a partner regarding PPE tracking. We are tracking information and shipments that are coming from the federal level, the state level, the private industry, the locals, all the way down to the individual hospital locations. So daily usage, distribution, we have forecasted information, really a very quick view of supply versus demand. And that is something that we have automated updates. It's updating the operational dashboard hourly, so that we do our best to enable that quick and accurate and up-to-date view for our decision makers. Similarly, we have a hospital status dashboard, and we're looking to see which parts might come together to complement one another. That's talking a little bit more about available beds and ventilators that are at the actual individual hospitals. That information is coming from the individual hospitals themselves. And we've also included the temporary sites, our tent hospitals. They too are feeding information into that operational view. And again, we are privileged to be able to provide these resources to the decision makers as another way of visualizing the data and being able to respond quickly to the ongoing event. Next slide. So I don't have any necessarily any fancy graphs or charts or things like that, because some of this starts to become operational and I cannot make it available to the public. But food for thought, we're talking about using that spatial component. We're locating resources based on the location of the population. One of them was talking about, are the testing sites located accurately? The individual we talked to said, well, we're putting them in at the VEEP locations, our emissions locations, because we know there's one in each county, or at least one, within close proximity. But, we said we can do an analysis and really help you pinpoint whether or not you need more. If the data is available regarding the popularity of one over the other, we can help you to identify if they've been placed properly, if they need to be staffed more, if they need more supplies. So again, all that can be revealed very quickly through mapping and dashboarding. Transferring options. So we talked about the hospitals. If we have thresholds set, and it will pop up as red if some minimum threshold is met or surpassed. In the mapping view, someone very quickly can operationally look at and see if a neighboring hospital has a significant surplus, and quickly negotiate the transfer of the supplies from one hospital to another hospital in order to try and, again, quickly meet the supply versus demand in the reality of it. Patterns in social distancing practices, what worked, what didn't work. Did we see a direct correlation once the stay at home was implemented within the state of Maryland? What areas may have complied better than other areas, and all of this goes into just understanding, what measures do we need to keep in place in order to keep Marylanders safe, Marylanders well, and are there other ways that we can, other practices that we can put in place that prove to be more effective, or make sure we're putting in place the most effective practices. And then just getting down again, we can see the movement of the infection, not just seeing, that the numbers have grown, or, it's not just numbers on a chart. It starts to come to life. It adds that additional dimension, and we can actually do, time-lapse mapping applications and showing how, the infection is surged in areas and then, come back into a recovery mode, and whether we're seeing resurgences or, hot spots. And I mean, it's just the revelation by just bringing a couple of layers that have a location component already available is just, it's really, there's so many wonderful possibilities and revelations. So again, this goes back to the open data concept. What other correlations and answers are out there that ideally the community, our brightest within the community, will start to research and then share that research back, so that we can all continue again to move towards recovery and rebuilding in Maryland. So I think that was my last conversational slide. So I went a few minutes over, but I thank you, and I'm available for questions and also feedback. Again, I always want to learn from the end users. What could we do better?
Well, thank you, Julia. And we'll now start the Q&A portion of our session. And as a reminder, if you want to ask a question, either use the GoToWebinar question window, or you can raise your hand so that we will unmute your phone line. Sheila?
Thanks, Sherry. Our first question for you, Julia. Are nursing homes, doctor's offices, emergency medical services, or other non-hospital entities included in your PPE tracker dashboard?
That is a very good question, and I am trying to recall. At this time, I believe it is just focused first on getting a handle on the brick and mortar hospital locations and the temporary tent sites for the hospital surge. But that is definitely something that I will take back to the group as consideration. Absolutely.
Thank you. How did you approach the data gathering needed for this level of tracking?
So actually, so I speak regularly with the other chief data officers throughout the country, and I walk away from most of those meetings feeling, again, very privileged to be in the state of Maryland. We have a culture here of data collaboration and data sharing that is far more advanced than many other of my colleagues have experienced in other states. We still have a long way to go, but we have been very fortunate. We have been asked, this is the data we want to display, and we have said, then you need to get us that data. And those with the data have complied. And so, again, it's just been a cultural thing. We've done a lot at a technical level. We're doing a lot with integrating with Google Sheets So we're a Google state, at least for government email. And so there's a lot of collaborative updating being done within Google Sheets because most people are familiar with, Excel sheets, and Google Sheets is very similar. So that has allowed us to centralize and compile data very seamlessly. But again, just moving forward and continuing to foster that culture of data sharing that is already alive and well in Maryland.
Thank you. Our last question, have you had any challenges based on the large numbers of people accessing the website?
That's funny. So that was one of the reasons why we decided to go with the Esri Hub site, because it technically becomes Esri's responsibility to ensure uptime. And they have relationships with Amazon Web Services, cloud hosting, and things of that nature in order to host these sites. However, and so we've experienced very little downtime. However, an SMS text message did go out through our emergency broadcast, and we were not aware that was going to happen. About 6 million Marylanders received the URL simultaneously, and it did bring down the entire part of the platform that was hosting our site. So Esri was able to get it back up and running in about 10 to 15 minutes. But thank goodness that was, I just had to put in the call and they were on it to fix it. I could not even have imagined our systems would have just probably exploded because our capacity, just wasn't anywhere near enough to handle something like that. So Esri has given us a considerable amount of bandwidth since then, and we have had no further issues.
Okay, well, thank you again to both of our speakers. And this concludes today's webinar. We appreciate everyone's participation. And as a reminder, an archived version of today's webinar will be available on 911.gov soon. The next webinar is scheduled for Tuesday, July the 14th at noon Eastern. A list of the remaining 2020 webinar dates is provided, along with a link to register. Thank you to everyone who has joined, and we hope you have a great rest of your day.